Welcome to Health and Wellness. I'm Dr. Jennifer Ashton. Today we thought we would explore cellular aging and what actually ages our skin so that then we can talk about what we can do about it. And our guest today, I'm happy to welcome back to the show, is New York City dermatologist Dr. Francesca Fusco. Welcome back.
Thanks for having
me. If you think about the cells in our body,
yes,
and skin in particular, as subject to a number of different stresses as we age, talk us through what kind of things both internally and externally contribute to aging.
Well, there's the external stresses that include the sun exposure, ultraviolet light, pollutants that we encounter every day, and cigarette smoke. Internally, there are things like excesses, and when I say excesses, I refer to if you're drinking a lot of alcohol.
What does that do to our skin?
Alcohols translate into sugars, and sugars produce what we call a glycation process. And this is a sugar that is very damaging to the collagen, the elastic fibers, and the elasticity of your skin.
A normal amount of cellular aging is what we would expect as we age, but what can happen when this process of aging goes awry?
Well, aside from the breakdown of the collagen and the elastic fibers, it also has the same effect on blood vessels throughout your body. So increased tendency to arteriosclerosis, atherosclerosis, and in turn this can affect many of the organs in your body, including your eyes, eyesight.
So where do you see the adverse consequences of cellular aging when you talk about hair and nails?
You would see it in the form of hair loss. Somebody would be complaining of excessive shedding or a very scaly scalp. Their nails would be weak and brittle and possibly even prevent with certain lines or white streaks on them.
What kind of things can we do externally to reduce that kind of cellular stress?
Obviously, everybody knows to wear sunscreen so that you decrease your exposure to ultraviolet lights. You should protect yourself with a sunscreen that has something like an antioxidant in it. Antioxidants are a big word, and what it refers to are things like vitamins A, C, and E that are incorporated into your creams that help to neutralize free radicals, which are chemicals in the environment that wear down your skin and break down your collagen and elastic fibers. Internally, you can keep a healthy diet. Eat right, just like your mother told you. Have 3 good meals a day, include green leafy vegetables, drink a lot of liquids, and that doesn't mean coffee and tea. That means water. Healthy water is good for you.
And stay with us. We're going to take a quick break for a word from our sponsor, and we'll be back with more cellular aging prevention and tips with Dr. Fusco in a minute. So welcome back to Health and Wellness. We're talking about cellular aging and some methods, both external and internal, that we can use to combat that when we talk about our skin. Dr. Fusco, go over with us some of the external products that are available to people and the pros and cons that you explain.
One of the gold standards is vitamin A, and you can get that either in prescription form, which some people know as Renova or Retin-A.
So those are retinoids, is that that's the whole class
those
of
are
them?
retinoids, and they're very effective at exfoliating off dead skin, but also encouraging collagen production and diminishing the appearance of brown spots that we see more of as we age.
And when should someone start using that? Do you recommend patently at age 35? Do you say 40?
As a matter of fact, that's the age,
35.
That's
okay.
when I do start recommending that somebody use some form of it, and usually we start with the over-the-counter retinol, which is readily available. Now, vitamin A, when you're using it, can make the skin appear dry and flaky and increase photosensitivity. So people have to know about protecting their skin from the sun.
What about the dryness? What do you suggest for that if it really becomes a problem?
Well, you can use a moisturizer with it or decrease the frequency to once every other day or once every 2 or 3 days.
Okay. And how much would that cost, the over-the-counter one?
It could range anywhere from $10 to $15 for a tube of retinol.
Okay, great. So what's next?
And so also you'll see peptides. This is another name that we're seeing a lot of, and peptides are available in over-the-counter products. And what they do is also help to combat the signs of aging, like the breakdown of collagen, fine lines and wrinkles, and those are available now in many over-the-counter products.
Same kind of price range?
Same price range, and no increase in photosensitivity.
Great.
So if somebody's outdoors a lot, they may use that.
Perfect.
Sunscreens, I have sunscreens here because those are very important in combating ultraviolet damage. And many of the moisturizers with sunscreens now incorporate antioxidants in them as well, so you get a double hitter there.
And what is coming down the road? What kind of things are you hearing about in terms of new therapies or technological breakthroughs in terms of creams right now, maybe in the future?
In terms of creams, it's things that fight glycation, which I touched on earlier, and oxidation.
So this is like a chemistry class
It
all
is.
over again.
It
Okay.
is. So now you have products that hopefully will incorporate sunscreen and some product to slow down the glycation process so it doesn't break down your collagen and elasticity.
Got it. What are the downsides of some of the over-the-counter treatment creams? Are there people who should not use them, or can there be allergic reactions to them?
If you're pregnant, always check with your physician. If you have very, very sensitive skin or a condition called rosacea where you're prone towards irritation and redness, you should do a test spot with one of these creams, maybe put it on your jawline and see how you do with that. And lastly, don't try too many new creams at once. Try one at a time.
What about some of the more aggressive therapies that you would do in your office? We hear a lot about the home laser treatments being available or being made available. What do you think of those?
It depends on which home laser you're talking about. There's something called LED technology, light emitted diodes. Those are very, very helpful. They're limited in what they can do, but complementing what you're doing in your doctor's office, they can be very, very helpful.
And then the lasers that you use are called what? There's a Fraxel.
We use lasers. Fraxel is probably the most popular because with very little downtime, redness for a day, you can get rid of lines, wrinkles, acne scars, brown spots.
We should also mention that I'm sure you have a lot of patients who come in seemingly for the cosmetic or aesthetic touch-up, and then you actually do find a pre-skin cancer or an actual melanoma. So it reinforces the importance of skin checks,
An annual
regular
skin exam is key.
really important.
Yes.
Thank you so much,
Thanks
Dr.
for having
Fusco,
me.
for joining us again. Thank you for joining us for another episode of Health and Wellness. I'm Dr. Jennifer Ashton. Until next time, wishing you good health.